Hello everyone, my name is Dr. Carla Murray, and today we are going to talk about HIV and the COVID-19 pandemic. So over the last 4 months, research has suggested that the elderly and people with chronic conditions are mostly and greater at risk. In a country like South Africa, where we have a population of about 60 million people, we know that 14% of our population has HIV, and 62% of that number is not currently on treatment. We know, and the CDC has suggested, that of this population, those with a lower CD4 count and those that are not on treatment are greater at risk. In 2018, we did a study in South Africa and we saw that 90% of our population knows if they are HIV positive or negative. But that means 10% of our population is currently not aware if they are HIV positive or not. 6 million people. So what should you be doing? Know your HIV status. Testing in South Africa is freely available. You can test at any GP's office, any local clinic, and any pharmacy. Home kits are even available. Adhere to local restrictions. These social distancing techniques are there for a reason. This limits your exposure to people having coronavirus around you if you are living with HIV. Limit your amount of time going out to the shops to get groceries. Plan these visits and plan ahead so that you limit the amount of times that you go out. Social distancing, hand washing, wearing a cloth mask, respiratory hygiene, and not touching your face frequently are all ways to prevent yourself from getting infected and also protecting those around you. Adhere to your chronic follow-up. Do not miss your regular follow-ups with your GP and at your local clinic. Don't run out of medication. You and your healthcare provider can work out a plan that works for you. Virtual consultations are now paid for by some medical aids. And if you are a patient in the state sector and you pick up your medication from their distribution programs, their pickup stations are still open during the lockdown. You can even nominate 2 people to fetch your medication for you. They just need to take their ID documentation with. Check with your healthcare provider if you are up to date with your influenza vaccine for the season. Eat well, stay healthy, exercise frequently, and sleep well. Stay in contact with people that you love. Say hello to friends and family regularly. We all need support during a pandemic, and especially during this time. Be well, stay well, and feel well.